Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Kim Eickhorst. Thanks for joining us today, Kim.
Thanks so much. I'm so excited to be here.
I am too. And by way of a brief introduction, Dr. Kim Eickhorst is a dermatologist, and she'll tell you more about that in a moment. And I'm thrilled to share that she's my dermatologist. So this is the very first time that I'm having one of my very own doctors
Oh,
on,
cool.
and it just fills my whole heart. I can't tell you how happy that makes me to have you on. So thanks again. And one thing that you shared with me is that you said most things that bring folks into the office are benign. It's the thing they don't notice that ends up being the dangerous spot. And I wanted to point that out to make sure that we did, because that's exactly how I believe you and I met. Is a few summers ago, I was with my college friends, and a couple of them routinely have a skin check, and the other couple of us do not. And they encouraged us to make an appointment to get, a skin check. So we did, and that's how I met you. And I pointed out a couple things, and you're like, "Oh no, that's fine." But you found something on my upper chest that was concerning, and it ended up having atypical cells. So I know that dermatologists save lives. So just thank you for the very important work that you do.
Yeah, thank you.
You're welcome. And today we'll start by talking about occupational hazards of being a dermatologist. So before we dive into that, I always ask what you'd like us most to know about you. And you can go into anything about how and why you chose dermatology, what your passions are inside and outside of medicine, whatever you'd like to share.
Awesome. Yeah, I have to be careful. I could fill the whole session with that.
Yeah.
Well, I think I guess I'll start with how I ended up in dermatology. So I'm from New Jersey originally. Both my parents are high school teachers. Mom was math, dad was kind of business and accounting. And I have no one in my family that's in medicine. But I've always been kind of artsy. Like I in high school thought very long and hard about if I wanted to pursue something in the art field, namely like drawing and painting. But I got worried because I didn't want to live the life of a starving artist. I actually even considered medical illustration for a time. But at that time, things were going very much more computer based rather than hand drawn. And I had an amazing AP biology teacher, Judy Daner. And I just really fell in love with biology and was fascinated by how the body worked. So I started thinking about medicine then. My parents kind of discouraged me. I don't want to say discouraged me, but not having anyone in medicine, not really knowing what it was all about, and obviously a long road financially, also a challenge. They kind of pushed me to look into other things or considered other things. I enjoy people, and my father was always a proponent of, oh, go into business. You'd be great with people in business. So I definitely took that to heart and kind of in college, just dabbled around, kept my doors open, did pursue some business options, and then also wasn't officially pre-med, but took all the pre-med classes. And that was all during my time at the University of Virginia, which I love so much. Charlottesville and UVA is near and dear to my heart. Any patient that comes in and starts talking about Virginia is in trouble, and my nurses will start to groan because they know I get excited and start going off on tangents about the university. So when I went to graduate, I still wasn't sure. And I think this is something I'd like to talk a little bit about today. Being a woman in medicine, and then also just the challenges and how medicine has changed. So I found this time in my life extremely intimidating. I'm a worker bee, and I just kind of have that feeling that, I might not be the sharpest tool in the shed or, the prodigal, what have you, but if I want it, I'll do everything I need to do to work to get it. So, but when you don't know what you're working for, working towards, it's a little nerve-wracking. So I spent a lot of time shadowing hospitals and doctors, and during that time, talked to male and female physicians alike and wanted to know, like, hey, should I do this? And it was intimidating. Yeah, so I knew that the only thing that I definitely wanted to be was a mom, and it wasn't okay to me to do either subpar. So I actually went into business. I, right from graduating from college, was recruited and went to work in Orlando for the Mouse. Yes, Mickey Mouse, Walt Disney World. I was not in the park. I was actually in part of their finance team, kind of making decisions or involved in making decisions and performa models as to if they should, build another cruise ship or build another hotel. So it was very interesting, but I quickly decided, pushing numbers around wasn't going to do it for me. So at the time, of course, felt like, oh, here I am zigzagging, but it was honestly one of the best things I could have ever done because it made me really hungry to go back to school and feel like medicine was the thing for me. So, got to med school, showed up, and immediately told my dean on the first day that I wanted to either be a dermatologist
Hmm.
or an orthopedist. Why? Well, I had a fabulous dermatologist growing up, a family lady who had kids, Dr. Polici. She was inspiring and she seemed to do it all. She seemed to be the person I wanted to be, had kids and a family. And then orthopedics, I've always been an athlete. And I just, again, kind of that knowledge of knowing how the human body works and literally getting someone back on the field and fixing them was very appealing to me. So I'll fast forward because I could go on about this story. But essentially, I found that orthopedics was like surgery doing like construction work, like
Mhm.
drills and
Mhm.
cement. And I was like,
Mhm.
oh no, that's not really for me. I'm just more into the delicate surgery. And I also kind of knew I wanted to do something with a surgical slant. I've always, as I said, been very hands-on and like using my hands. So I went again to the dean and she said, well, both these specialties are super competitive. And I said, okay, well, what do I have to do? She said, well, you have to be first in your class and you have to, do all these papers and do research. I'm like, okay. So I went to someone in my medical school who's very well known, and she basically told me that I didn't know what dermatology was about. I wanted to go into it for the lifestyle, and that if I wanted to do research with her, I would have to quit med school for the year and basically just do full-time research. And I was like, well, that's not going to work.
Mhm.
So I went looking again for another specialty that would meet my needs, and I actually applied to urology. Urology at the time, I don't even know now, was a early match, but it basically checked my boxes. I love the finite surgeries. I thought about going to urogynecology, so helping women. I had again another amazing mentor, Joe Barone, Dr. Joe Barone. And I literally did enter the match. And then I started doing my clinical time mainly with the men. And I realized I was going to have to do 6 years of in-hospital prostate and penis care. And that was fine by me, but it actually wasn't really fine by the patients. There was such a dichotomous response when I walked in the room as a young female physician. It was
Mhm.
either like, ooh, honey, come over here, or she's not touching me. So
Mhm.
I just decided this wasn't going to work. And so despite my dean's, mandate that I'd have to be, check all these boxes, do research, be first in my class, I decided to give dermatology a try. I must say my last year of medical school was somewhat depressing because I felt like I wasn't going to get in, just because I had been told I had to check these boxes that weren't all checked. But sometimes things work out, and I matched in dermatology, and then from there went on to do a Mohs fellowship in procedural dermatology. Moved to Connecticut with my husband, who's a was an orthopedist, is now a radiologist at Yale in their musculoskeletal division, and joined Dermatology Associates of Western Connecticut as their first Mohs surgeon. And pretty much that's where we are now. And in my practice, I mean, I do Mohs surgery, which I absolutely love because there's that artistic, reconstructive part of my job, but I do all procedures, see all patients. I always say from the babies to the elderly. So it's just so nice to be able to offer people really 360 degrees of dermatologic care. I feel like I can really take care of them. And I guess I skipped over that, but I think that's really the main reason I went into medicine. I wanted to have the knowledge, the tools, and the skills to fix things to make people feel better. And I was never comfortable, and I joke about this with my patients because when people do have a skin cancer, it runs the gamut. I mean, some people we can barely get into the office to get it treated. They think it's a nothing. And then other people have superficial skin cancers and they're, getting out their will, like they're really upset about it. So I just try to encourage them to take, any emotional issues out of it and just focus that, this is such a great scenario. We can cure this. I mean, 99% cure over your lifetime. It's very low risk and extremely high reward. So, again, that's what I like about my job, that I am helping people. I'm not holding anyone's heart, at least physically,
Yeah.
in my hand, not doing brain surgery, but definitely making people feel better and do better. So I'd say that's pretty much how I ended up in medicine, interest in the human body, and then also love that kind of creative part of surgery and fixing things and making people better.
Wow. Well, thank you. I already learned so much from you.
I could have got a lot more,
And
believe me,
yeah,
I'm a talker.
well, we'll have to have another chat. But a few things I quickly want to say is I have a cousin who graduated from the University of Virginia. He's a chemical
Oh,
engineer. That was his
oh,
degree anyway. And so that resonated with me. And also when you talk about artsy, and I think that's so important because I had the most incredible radiologist, and he too was a photographer and an artist, and he actually went to college, I think, in part on a
oh, wow.
scholarship. And I could say that I think you have a bionic eye, you know? So, and I think that when you use it, and I know that you like photography too, I think
Yes,
you shared
yes.
that with me the day that I met you. So I think that's so interesting that you use all those parts of your brain, right? Because I think some of the analytical skills are on the other side
Yeah.
is those creative artsy skills. And I think that's part of what makes you an amazing dermatologist. And I also have to say about because as a physical therapy student, I watched a couple surgeries, and I think the first one was a girl that had fractured her elbow or something, and that's when it first hit me that wow. Orthopedic surgeon or carpenters that work
Yeah.
on people. And
Yeah.
exactly what you said. They have hammers and nails and screws and saws. And that, that's what that really resonated with me when I saw that. And then the one person maybe I could connect you with on LinkedIn is Dr. Diana Londoño, and she is a urologist, and she's one
Oh,
of the very few percent, especially of Latino female
yeah.
urologists, and she is super cool. So I'll have to connect the two of you on
Yeah.
LinkedIn. And so now, as we continue on, what are some of the occupational hazards of being a dermatologist? What would you like to share?
There are many. There are many. I think kind of going along that I said, I was interested in medicine because I wanted to fix things. And so in dermatology, a lot of people just believe, oh, throw cream on it and it will, make it better. One of my favorite things that patients say, oh, could you refill that cream, the white one in the tube? That's like every cream we
Yeah.
prescribe. Excuse me. So, I think people, especially today, medicine has been kind of blurred. The lines have been blurred, especially in dermatology with cosmetics. And I do both, I do medical as well as cosmetic, and, they can complement each other very nicely. But I think that dermatologists really have become a little bit more known now for Botox and fillers. And it's really a shame because we really do so much for your health. Your skin is your largest organ. It's on the outside, so it takes a beating. And I think that people think they come in and you're going to immediately fix all of their problems. And that's tough for me because, as I said, I am a fixer and I'm a people pleaser too. I want people to be happy. I want them to feel better. But, some things you can't just snap and make them go away. Many things in medicine are chronic or, require continual care. So, I think sometimes patients get a little frustrated with me when I don't tell them kind of what they want to hear. And
Mhm.
I've literally had patients say that to me, well, you're not telling me what I want to hear. But it's important to be honest and set expectation. And, I want everyone to leave my office happy, but sometimes the truth hurts, I guess. And there are definitely things we can do as dermatologists to ameliorate or make, better these certain conditions, but there's not always a simple fix for something. And I think along those lines too, it takes a long time to see any doctor these days. So people come in with a 20 item hit list of all the things they want covered in their very short appointment. And they kind of feel because they've waited all this time, they want everything taken care of at once. And so that's very difficult too. And I would say or caution both providers and patients, just like any doctor. I mean, you're kind of once a year is your physical, and that's really where we're drawing a line in the sand between, okay, is there anything on your body that is cancerous or that is medically necessary? And again, that to take care of, that's another blurred line. Medically necessary versus not medically necessary, which we often will just say is cosmetic. But I think people hear cosmetic and they think, oh, I don't want to look better. I just don't like this. And it's like,
Mhm.
well,
Mhm.
unfortunately, we don't get to decide that. I mean, insurance does. So,
Mhm.
and I mean, that's another tangent we could go off on. I think as a physician, one of the beauties of being your own boss or, being in charge of the decisions you make, some of that has really been lost. And I can't even take care of patients in the way I want to because of, limitations on prescription drugs or hierarchy of different management tiers before you get to a certain drug and then cost to patients. So, it's just tough. I think the general public has difficulty understanding that I can't do carte blanche what I want or necessarily what they want. And so again, sometimes that ends in a little heartache for the patient. They want to come in, get every single one of their spots taken off. And that's, this day and age, that's just not really how it works. We're only really obliged to take off, or I guess we should say compensated to take off things that are dangerous or suspicious. So that's always a difficult conversation to have with the patient. And
Mhm.
then the other thing that I think is quite funny is, first of all, everyone comes into the office and a full body exam is actually the request. It would be great if we could see your entire body in our office because most people feel more comfortable. We say it's fine to keep your bra and underwear on and we'll kind of look around. But it's very interesting to me how it runs the gamut. Some people come in and they could be dancing around the room naked. I'm not even kidding. I've had elderly patients that had breast reconstruction. One of them just after a few years just got her nipples tattooed and she had to show me and and like, aren't these the best nipples you've ever seen? So the level of comfort, and then there's some people who I can barely like peek under their gown. And I think too, for me, growing up in a very, it's the right word,
Modest or
my parents were very kind of tight to the vest about, whatever
mhm.
demure, like I'm not walking around the
Like
house naked, or that wasn't something. I guess everyone was kind of private, is
yeah.
maybe the best word. But now to me, even when I see people from Newtown, which is the town I live in, I feel like they feel strange. But I don't even see nakedness. I literally just see skin. I've seen so
Uh-huh.
many naked
Yeah.
people
Yeah.
that really is so desensitized. So I
Mhm.
guess I just mentioned that because I know it is uncomfortable for many people, and I would hate to
Mhm.
for that to be the reason that they don't get checked. And really, we have seen so much of skin and nakedness that we
Mhm.
don't even see that. We're really just doing our job and looking to make sure nothing's dangerous. So I just think it's funny how there's such a range of how people react. Um, but back to the other hazards, I call it the magic wand phenomenon. I tell patients that my magic wand is on back order, so I'm happy to let them know when it comes back in
Mhm.
because I wish I could fix everything for them. And then we have the same common growths that pretty much every patient that walks through our door has in. And what I find amusing here is that they think they're the only one. So, a common growth that I often will call a skeratosis, and that's a Dr. Eickhorst word, certainly not medical terminology, because it will often be the one thing that brings folks into the office is it's doing all the things that you kind of hear in the media, like it's growing, it's got texture, it's multiple different
Mhm.
colors, it has arms and legs. And quite frankly, those are things that we recommend you look for in growth. So I'm actually happy when a patient comes in because and they're complaining of this growth because it means they're paying attention.
Mhm.
And but thankfully, luckily I'm able to tell them these growths, which are actually scientifically called seborrheic keratoses,
Mhm.
are benign and they have a distinct look that I, as a dermatologist, can easily tell and I can give them reassurance. But I think that speaks to another occupational hazard is, basically whether it's a growth or a skin cancer, I tell the patients these growths do not read the textbooks. Like there's not like a mug shot of every single growth. They look different on different people, and part of developing a relationship with a dermatologist specifically is for you to report to them, like if you see something changing, to then go to the expert and have them weigh in. I think I also hear a lot from patients like, "Oh, I'm so sorry. I'm so sorry I wasted your time because it was a nothing." And I said, "Are
Mhm.
you kidding me? This is the best outcome. And you
Mhm.
did the right thing because it's kind of like that old, I think it was a New York City subway line. Like if you see something, say something
Mhm.
because I don't go home with you and you see your body changing, more than anyone else." So those little clues are so helpful to the dermatologist. Another occupational hazard is aside from my regular job, I also have a side job. I can't
Mhm.
tell you how many texts I get from family and friends throughout every single day with blurry pictures of, I can't even see where it is on the body, no history. Like, what is this? What should I do? So I think it's super important. The New York City subway, that's what I was saying, is that they used to have a little tagline, if you see something, say something. And this is so important. You really have to develop a relationship with your dermatologist. So it's up to the patient to alert the dermatologist if something is changing, because we don't go home with you, and then to come in and have them actually physically examine it. There is still something that's so important with dermatology to feel, touch, lighting. And that's not to mention just the regular medical history and symptoms. So it's definitely an occupational hazard to get blurry cell phone zoomed in photos because it's really tough to help people. I will say, never in my life did I think I'd have to worry about job security being a physician, and then especially as a surgeon. And then COVID was a rude awakening for everyone, as well as it was for me, because you can't do surgery over telemedicine.
Mhm.
But that was one part. And then the other part was just trying to do physical exam through the internet. It is not the same. You
Mhm.
really, things are so skewed and it's really tough. So there's nothing beats coming in and talking to the physician and having them actually examine the spot. Um, so yeah, those are just a few things. And then I think too, like we mentioned earlier, there is that slippery slope of medicine blurring into cosmetics. And um, I think sometimes because of that, dermatology starts to be looking more like a business. So instead of patients, the clientele is looked as clients. And I think that's sad. I really, because I want to treat patients not just as a client. They should be patients and we should be taking care of everything. But we live in a very entitled society. And so it's really becoming, I can see my light here. You know what? I'm going to try that. I think that, that becomes very difficult to navigate both as the physician and as the patient. So
Mhm.
yeah, there are many. And then I think being a female and being the owner of a practice, having to be the boss also is very difficult. Um, I was having a discussion with a friend the other day, and we were talking, and I said, "Well, I'm not a feminist," and she said, "What do you mean? You don't think women and men should have equal rights?" I'm like, "Well, yeah, of course I do,
Mhm.
but I guess I'm not an extreme feminist."
Mhm.
So, being a woman in medicine has never bothered me. Definitely in my training early on, when I'd walk into a room, and no disrespect to nurses, we are super, super important, but it was just assumed that I was a nurse
Mhm.
because I was female rather than male. But I don't feel that my sex has held me back in my desire to progress in my career, but it has made it more challenging as a business owner. I feel that I'm even talking to my husband and comparing notes that um, when a man critiques one of their staff or what have you,
Mhm.
it's a little bit more respected with a
Mhm.
woman, no matter how I deliver the news, because I've tried all different types of ways.
Mhm.
It's often received in a different light from employees, which is troubling.
Mhm.
So there's also a difficult line that has to be drawn between being encouraging and enjoying your employees and not being friends. When I first came into practice, I didn't take heed to that and wanted to be friendly with everybody and found, that didn't work either. So I just
Mhm.
think that is one of the things that I do feel is different between men and women is being the boss and how that kind of affects your day to day. It's definitely a lot of stress for me managing my employees and trying to maintain a leadership position and authority, but still being the nice, happy, friendly, kind person I want to be.
Mm-hmm.
But
Right.
yeah, I think those are definitely some of the major occupational hazards, and I'm sure they cross over many other specialties as well.
Yeah, well, thank you for sharing that. And I know recently a surgeon said that she went in to do the surgery, and someone in the OR said, "Oh, well, who are you? We're waiting for the surgeon." And she's like, "I am the surgeon." And they said, "Are you sure?" Isn't
Oh
that
my
horrible? Like,
gosh.
it's
Yeah.
almost too much to be believed, but that's even in this day and age. So it's important to spotlight that, and
Yeah.
to raise awareness that we're not talking about the 1950s, we're talking about today. And
Yeah.
a couple things that you had shared with me at one point is even as far as what gets covered by insurance. Like people tell you, well, just take this off or bill it or code it however you need to code it, right? And you
Yeah.
can't just do that ethically, right?
Yeah, no, that's also been I think I was talking a little bit about entitlement of the patient and even them feeling like kind of like we're at Stu Leonard's, like the customer is always right.
Mm-hmm.
And I listen, I don't ever feel that I have to prove myself. I've been through medical school, I've passed all the tests. I'm here to help people.
Mm-hmm.
And when they come to visit me, I would hope that they're there for knowledge and to assist them, but not everybody is willing to take my advice or my direction. And so again, I feel like there's a little bit of entitlement that they're coming to me so that I can tell them what they want to hear, whether that is I echo what Google told them or that yes, I take their spots off even though they're not medically necessary and fudge the records to say that it was. So it's that's been a very uncomfortable position for me. And back to our other discussion, I'm curious how often that happens with male patients, or
Mm-hmm.
excuse me, male doctors, if
Mm-hmm.
people would be so quick to do that. I'm kind of aghast sometimes how I'm treated by patients.
Mm-hmm.
And again, I'm proud that I don't think I've ever been one of these doctors that's like, I'm a doctor, and
Mm-hmm.
you
Mm-hmm.
must address me by doctor and that
Mm-hmm.
I need to be put on a pedestal. But I do expect common courtesy to be treated just like you would treat anyone else, kind of the golden rule. And
Mm-hmm.
I do feel that's lacking sometimes. I mean, I'm happy to say, I've practiced in New Jersey, New York, and Connecticut, and even Manhattan. And I do think overall, our patient base here is lovely and they're much more gracious than other areas that I have worked in. But it is upsetting, and of course, it's the not so nice ones that you remember sometimes more than the nice ones. But that people feel entitled to do that, and sometimes I do. I feel like a punching bag because as the physician, I have to be the upstanding one, not get emotionally pulled into that. But as I'm sure numerous people have said, physicians are people too. And,
Mm-hmm.
it's a lot. It's a lot to deal with all of that emotion and thinking and psychology and still try to do your job and do it in a quick manner and, all of that. So
Mm-hmm.
I think sometimes patients do forget that doctors are human too.
Yes, and thank you. And I shared that in most of my episodes. And also, every time a doctor shares their story, another doctor feels less alone. So some of the things you say will resonate with other physicians. And then they're like, oh, yeah, well, I experienced that too. And that helps everyone. It helps patients humanize doctors, and it
Yeah.
helps doctors feel less alone. And another thing you share with me that's a little more unique to dermatology is with other specialties, they don't necessarily expect their doctors to like look perfect or be good looking. But if you're a dermatologist, right, and they expect you, so if you wanted to speak a little to that, because I'm like, oh my gosh, like with everything else to add that layer on top of all of the other stuff.
Well, I think it goes, a little into what we were talking about earlier. If your doctor was treating you for acne and the doctor had a pizza face of acne
Mhm.
all over, you're going to lose credibility, right, in their ability to treat you properly. So, and I think with cosmetics coming into the realm, and then of course social media, where everything is public and trying to keep up with the Joneses, I do think there's a little bit more of an emphasis on that because, in a way, I mean, I don't want to say all doctors, but so many doctors, right? Where we have to advertise now too. So when
Mhm.
you're marketing yourself in the world of dermatology, you have to play the part a little bit. And when you're playing the part, that also becomes competitive, looking over your shoulder. Well, oh, this one's doing that, or they're showing this on social media. And so I'm sure many physicians, feel to advertise their business or what have you, they have to be on social media. But I feel even more so with dermatology. And then, in addition to just doing our job, and because we do kind of hold that arena of cosmetics, we're also, I guess you could say, competing with the Medi Spa business.
Mhm.
And so, which I'm not discrediting Medi Spas, but people don't have a sense, when I say people, the general public, of
Mhm.
how the two differ. And so we have to really work on credentialing ourselves and letting people understand, how are we different? Why are we different? So that's just like a whole nother realm
Mhm.
the medical practice that I'm in anyway, and most dermatologists that definitely medical school did not prepare
Mhm.
me for.
Mhm. Right. And some of the things that you're not competing in the same way with somebody that performs colonoscopies, right? Or
Yeah,
something
I
like
mean,
that.
right? It's it's true.
Yeah.
It is true. So it's just
Yeah.
another component of what I do. That is another, demands time, attention, energy, all of that. Just even how good your website's looking, or what you are putting on social media, or how what you look like when you interface with your patients, and all of those things.
Well, one thing I'll share was earlier this year, I had something kind of show up overnight, and I wasn't concerned, but I messaged my primary care doctor because he wants to be abreast of everything, and he did tell me to send you a picture, so I did, and he says, "Well, given your history, because I have had cancer several times," he said that he wanted me to see a dermatologist, so you weren't available, so they got me in with somebody in your practice, and he looked at it, and he wasn't concerned. But again, I guess given my history or the fact that it showed up overnight, like that was a little abnormal. So
Right.
we went back and forth, and he's like, "Well, we could just sit here talking about it all day, or we could take it off, right?" So then he decided, he goes, he was pretty sure it was going to come back negative, which it did. But I
Good.
appreciated that dialogue, and then I was
Yeah.
the same thing. I'm like, oh, like, because then when it's okay, you're like a little embarrassed you went in, and, but you don't have to be, because it's better that and know that it's nothing. And so, do you
Yeah,
have
I
any
would.
final words as we wind down uh,
Well,
to share?
yeah, yeah, sorry. I think that's a really important thing to just underscore, is because I hear, and we talked a little bit about it before, and then you just brought it up, but I think people are sometimes resistant, um, just to go and get checked out, because they kind of do feel, not that it's a letdown, but as I said, patients say, "Oh, I'm sorry, I wasted your time."
Mhm.
But that's really what we are there for as dermatologists. Like all your physicians, it should be a dialogue, it should be a relationship. And, listen, everybody's different. I have a different style than maybe some of my colleagues. And I think it's super important for people to find someone that they're comfortable with, so that they can have those conversations, they can have that dialogue. And that if they see something, they can come in, and then the doctor can say, well, it's fine, or let's biopsy just to be sure, because you never know. And I tell people
Mhm.
that all the time. I'm a physician. I have all this training. I'm obviously weighing the risks and the benefits, but at the end of the day, even though we're in, 2024, almost 25, medical science and all these crazy things we do, nothing is 100%. So it never hurts to
Mhm.
check. And you should never feel bad about asking, or, coming in, even if it does end up being benign. So,
Yeah,
and,
well, thank you. So I'm going to ask how our listeners can get in touch with you. The one thing I do want to end by saying is get a skin check, and especially doctors. If they think they're fine, they might not take the time. But right now, I have a friend. She just got a routine skin check, and she has a serious skin cancer on her face, and she didn't even see it, and it's on
um,
her very own face. So dermatologists are specialists in that. So everyone, get your skin checks. And how could our listeners get in touch with you, Kim?
yeah, so probably the easiest way is just my Instagram account. I'm on Facebook as well, but it's Dr. E for Eickhorst, so Dr. E, and spelled out AND, dermatology. So Dr. E and dermatology, and that will bring you to Instagram and everything else. Or alternatively, you can just go to my group's website, which is www.dermwest, spelled out conn.com. So derm, DERM, WEST, CONN, so for Connecticut.com.
Okay, well, that's fantastic. So thank you again for being my guest.
Absolutely. I loved it. Thank you so much for having me. I really appreciate it.
You're very welcome. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.